Hello and welcome to Respiratory 2140. This is the week 2 for this semester video on oxygen administration and therapy. So for this video, we're going to discuss when to give supplemental oxygen and how to administer it properly and at what measurements. So we're going to first go over the equipment and then discuss, as we go through it, we'll discuss the theory. So first of all, you need a 15-liter flow meter that attaches to a 50 psi outlet in the wall. As you can see, these ones are it's hard to see. These ones are labeled for oxygen and have a 50 psi outlet that attaches. Green is always supplemental oxygen and you'll always have 100% oxygen coming from the wall. You'll also see yellow, which will come in our next video, which is medical air. And we will address that in our next video when you would use medical air. But be aware that green is oxygen, yellow is air. One attachment you will have is what is called, you'll hear it commonly called a Christmas tree or a nipple nut adapter. What this does is it screws onto the bottom of the flow meter to allow for different connections for oxygen. So we'll do that right now. Just screws right on to the bottom of the flow meter. Some of the most common respiratory equipment you will see, the one we've all seen and are familiar with, is the nasal cannula. I'll show you guys how to set that up. A simple mask, a non-rebreather, and sometimes you will see a partial non-rebreather, a Venturi system. This is one type, there are different types. A pulse oximeter to monitor oxygenation, and at times a bubbler. So to begin with, we need to make sure our flow meter, which lets us deliver liters per minute, so wherever the ball is on our liters per minute, allows us to track, we need to hook it up to the wall. So simply what you'll do is attach it to the connectors and push. You'll then be able to turn the knob to adjust the liter flow. So nasal cannula sits inside the patient's nose, goes up and around their ears for it to stay in place, and then you pull this snugly beneath the chin. This end, here's our flow meter again, connects right onto our Christmas tree adapter, and that's how we have oxygen lead from the wall to our patient. The nasal cannula can be ran from a half liter to 6 liters of oxygen. Anything higher than 6 liters of oxygen, you need to move to a different type of oxygenation device. So a half liter to 6 liters. Okay? One thing with the nasal cannula is if you have a patient that has been on the oxygen for a while, remember, oxygen is a very cold and very drying gas, so you can use what's called a bubbler. So with a bubbler, what you do, it will come in a nice little package. You take this piece off, you take the adapter, you screw it on top, next you will take the Christmas tree off of your flow meter, attach it to the bubbler, and screw it on. After that, you will take your end of your connector, your oxygen tubing connector, and stick it here so that the oxygen will come down below bubble up and provide some humidity through the nasal cannula. This can also only go up to 6 liters, otherwise back pressure will occur and the bubbler will expand and it will hiss. There is a pop-off valve, but it hisses and gets kind of angry at you. So make sure you don't go above 6 liters of oxygen if your patient is on a nasal cannula with a bubbler. So you can't do a fast switch if you're having increased oxygen demand. So we're going to attach our nipple nut or Christmas tree back onto our flow meter, as we see. Next, we are going to talk about the adult simple mask. So this is an adult simple mask. You can see this does not have a bag in the front. The oxygen has a straight connection to the mask. We have these air holes, so it will sit on the patient's face like this. You can bend, there's a metal bar right here, you can adjust it to make it fit for the patient, and an elastic to go up and around the head. After that, we follow our oxygen tubing and connect it to our flow meter. The adult simple mask is typically ran from 6 to 10 liters of oxygen. It can go up higher if you need to, but it can't go lower than 6 liters. And the reason for that is because with 6 liters, it allows for CO2 washout in the mask so that your patient doesn't have increasing CO2 due to exhalation. So even though we have these holes, we need a minimum of 6 liters of oxygen on a simple mask for CO2 washout. 6 to 10 is the normal range. If you do need to go up to 12, that's appropriate. Okay. The next one is the non-rebreather. So non-rebreathers are capable of reaching up to 100% FiO2. FiO2 is fraction of inspired oxygen due to this reservoir bag. So let's break down the different pieces of the non-rebreather. So we have the non-rebreather mask. It fits on exactly the same as a simple mask, except we have the wire at the nose if we need it. Except on the inside is a one-way valve, which allows for oxygen to build up in the bag, and I'll turn it on and show you. And then also flaps that allow for oxygen to build up in the mask. So we hook our non-rebreather up to our oxygen source, our flow meter, turn it on, and see how the bag fills up. You will run the non-rebreather anywhere from 10 to 15 liters, or even flush. Flush means it's just open at the very top of the flow meter. How you know you have it set to an adequate flow is if the patient breathes in and the bag stays inflated, you know you have an appropriate flow for this mask. If your patient takes a breath in and the bag collapses while the patient is breathing in, you need to increase the flow to your non-rebreather. As your patient breathes in, this valve will open up, allowing all this oxygen that is built in this reservoir to enter into the mask and allow the patient to have a higher percentage of oxygen. Non-rebreathers are very commonly used in emergencies, so that's where you will commonly see it. Okay. You might see on your boards or on different tests a device called a partial non-rebreather. It's a piece of equipment that's not commonly used in this area, but we're going to touch on it. So it's the same as a non-rebreather, except one side is completely open to allow for either access to the patient or excessive CO2 exhalation. So basically where we would have these holes, it's kind of hard to see. On the side would just be open, and that would be considered a partial non-rebreather. The last one we're going to touch on is called a Venturi. So I know in theory they're going to talk about the Venturi principle, but very quickly what it is we want to give a certain percentage of FiO2, and we only have a certain liter flow we can use. So we set our percentage of FiO2, and on it there's a little cheat. We have what liters we have. So for example, I want to give 40% FiO2. I'd follow it down, and I'll bring this to class for you guys to see, so you guys can see it up close because it's kind of hard to show you in the video. It tells me I need to run it at 6 liters. A time you would use a Venturi is if you need a higher flow, so that means we need more just volume of air for our patient, but not as high of FiO2. So that is commonly used to help us have more flow or more volume of air coming at our patient, but at a certain, maybe at a lower or a slightly higher or whatever FiO2 the patient needs. One thing that is commonly used is you can take off this device off the mask and attach a trait collar, which I will show you in the next video what a trait collar is, to help trait patients travel. This is all monitored through an SpO2 monitor. This is a pocket one that I have in my bag. Most of the time, a lot of them will be used with monitors in the hospital or vital sign cards. So you turn it on. Some important things are to make sure that there's a light on the inside, that it reaches all the way through, is in a location that can reach all the way through. And then it should read your SpO2 and your heart rate. So I have a 99% SpO2, 98, with a heart rate of 73. If for some reason I was low on oxygen, that's how you would track it. If your patient had a lower SpO2, you would administer more oxygen. If your patient had a higher SpO2, like 199, you can start decreasing. And that's how we begin to titrate oxygenation, to help our patient with oxygenation. That is it. Come to class with questions and we will address those, and we'll play, and we have different types of equipment for you guys to work on. Mostly I want you guys to focus on the ranges for liter flow. So remember, the nasal cannula is 1/2 liter to 6 liters. A simple mask is a minimum of 6. A non-rebreather and a partial non-rebreather are 10 to 15 liters or flush. And then the Venturi depends on your FiO2 and your Venturi device. Okay, thanks so much, guys.